I'm Stephanie Zanvetter. I'm a physical therapist at Gaylord Hospital. I'm a clinical specialist for stroke. And for today's topic, we're going to be covering stroke recovery, the different phases of stroke recovery, and what we refer to as the continuum of care. Generally speaking, one of the biggest questions we get asked is regarding discharge planning. This is something we'll get into topic-wise in a little bit here, but many times there is a team meeting that will take place. In this team meeting, it is discussed as far as barriers to discharge, and that's essentially what stands in the way of you as a stroke survivor being able to go home or to take those next steps in your recovery. It is also discussed essentially amongst your therapists as far as different equipment needs that you might have, whether or not you might benefit from any training of your family members or caregivers or loved ones to help assist you in being safe at home as you make the transition from hospital into your next steps. When we talk about the continuum of care, for most individuals, the journey begins, of course, in the acute care hospital. In the acute care, the first step is basically being able to determine, of course, the reason for admission, right? So this is where they are often doing an MRI or a CAT scan. These are tools or tests that are done to confirm, of course, the suspected diagnosis of stroke. These are also tests that are helping to determine what type of stroke this is, right? Is it an ischemic event, right? Did the stroke occur as a result of a blood clot? Or is this a hemorrhagic event? Did the stroke occur as a rupture of a blood vessel or a bleed in the brain? These tools are also helpful in determining essentially specifically where in the brain the stroke has occurred, and this is important information, of course, for your doctors as they make those critical next steps in determining what the next course of action should be. For some of you, this may involve a procedure such as a mechanical thrombectomy, or perhaps a coiling or clipping of an aneurysm, okay? And so these are different procedures that are done, again, depending upon the type of stroke that you as a survivor have had, but this would determine whether or not as an individual you need a medical procedure or an operating room, right? It is also determined essentially with respect to the acute care visit whether or not you're a candidate for a medication, TPA, which is a clot buster medication that is often administered to individuals pending they meet certain medical criteria. Many times that is that the stroke is of an ischemic nature, that the individual has presentation and is able to get to the hospital within a certain time frame, right? And then there are several other medical criteria that need to be met, essentially to determine whether or not one is a candidate for this medication. Upon the admission then to the acute care, most individuals are then admitted essentially to a neurointensive care unit. And this is essentially an area whereby the individual is on monitor, so you're hooked up to blood pressure and telemetry, many of you, oxygen perhaps as well. And this is something where the physicians then are coming in and doing neuro checks. Usually it's every 15 minutes or so to observe for any changes to your presentation. And that is because what we have learned naturally is that sometimes a stroke can present itself as very sudden onset, right? I'm okay 1 minute and I'm not okay the next. Sometimes a stroke can present or evolve, if you want, over time. And so the purpose of these checks, right, is to make sure that from an evolution perspective that you are then deemed, if you want, medically stable. With respect to the planning process, once you've gone through these different phases, right, begins the process at this thing from discharge planning. Some individuals, right, will skip some of the steps in the continuum and transition automatically then to home with continued therapy, either in the home or outpatient. We're going to get into that in just a moment. The idea is to sort of appreciate that those who make this transition often have minimal deficits. They are able to demonstrate their physical abilities at the acute care hospital with those therapists or that team working with them, and or if assistance is required, it is something that a caregiver or loved one is able to assist with from a transition perspective. And so ultimately what we're getting at, of course, is that not all stroke survivors come to Gaylord. So we're going to kind of talk, of course, about how you got here and why you're here. Gaylord is by definition a long-term acute care hospital. And so we are a hospital-based system. With respect to that, you can expect, of course, to have physicians here 24/7, nursing, respiratory care if necessary, right? All of you are also participating in evaluations by your therapy team, by nursing assessments, right? You're being evaluated by your care manager as well, whose role is to help with facilitating your care while you're here in the hospital, as well as making those next transitional steps to the next level of care in the continuum. With respect to the length of stay for our stroke survivors, we get asked this question quite frequently, really. Generally speaking, our length of stay is about 3 to 4 weeks. I say generally, and that there are some outliers to that, and a lot of it depends upon an individual's insurance and then medical needs and or medical stability. Because we are a hospital-based system, naturally, for an individual to come to Gaylord, medical criteria need to be met, and for an individual to stay at Gaylord, medical criteria also need to be met. And that is ultimately that once an individual has been deemed, if you will, medically stable, from an insurance company's perspective, they are looking to help that individual or that survivor with transitioning to the next level of care. And there are many others. So an inpatient rehab facility is another rehab center whereby the length of stays are a little bit shorter than what we might otherwise see here at Gaylord. Goals-wise, mobility-wise, and therapy-wise, all very similar in nature as far as how they are addressed. With respect to the path that our stroke survivors take when they leave Gaylord is generally speaking one of two. The first we'll discuss is essentially transition to a skilled nursing facility or a subacute facility. This is essentially another rehabilitation center whereby the goals are essentially to continue what you as a survivor have initiated here with us at Gaylord and to help with increasing and maintaining that consistency and intensity of therapies. Many times in this particular setting, therapies are offered daily, usually 5 to 7 days a week, of course, depending upon the facility, for an hour to an hour and a half a day, which is for some of you quite comparable to what you've been receiving with us here at Gaylord. With respect to the average length of stay in these facilities, again, it's variable depending upon you, of course, as an individual, but an individual might expect to stay somewhere within the ballpark of 4 to 8 weeks. Again, there's quite a bit of variation within that. Most of these facilities also will have long-term placement and or assisted living, should that be necessary, and or something that would be pursued at a future time, right? One of the things that is hardest in making this determination with folks, of course, is that no one here, right, has a crystal ball in order to predict the future, right? And so what we work with folks on is essentially how we are presenting here at present and with respect to making recommendations for that next level of care to best meet your needs. We get asked the question a lot here as far as, well, why can't I just stay here at Gaylord? I really like my team, I like my therapies, I like my doctor. I really don't want to move on and go to another place. And believe us when we say that if we could keep it that way, it's the most logical way to do it, and that would be great. The answer really comes down to the idea that because we are a hospital-based system, we are not always able to keep folks just for those rehab needs. Hence being why your rehabilitation team, and you can certainly ask your care team for more information, but would then be recommending the transition to another facility whereby the rehabilitation component, the rehab component is there, right, with less medical needs. Many of you, when you leave Gaylord, will transition to home with home care therapy. Essentially, this is where the therapy will continue in the home environment. This can be physical therapy, occupational therapy, as well as speech therapy. As far as the duration and the frequency, so many times from a duration perspective, we're talking about maybe 3 to 4 weeks, and there's some variability, of course, within that. Frequency, usually 2 to 3 times a week, right? And so what we're seeing there, of course, is for those of you that have been with us here at Gaylord that are receiving, many of you, upwards of 3 hours of therapy a day, right? Now we're making a transition to home where the therapy is just a few times a week. To help in that transition, of course, the team here will be helping you, if necessary, with some exercises that you may be able to do to supplement, right? As well as helping to train your loved ones to assist you, if necessary, in your mobility and your safety with respect to either self-care tasks and or being able to navigate safely within your home. We are almost at the end of our continuum, guys. We're at the tail end here. So outpatient therapy. Some of you, believe it or not, when you leave Gaylord, will leave and go home, and with the recommendation to continue with outpatient therapy services. And certainly we have some satellite sites where you might like to continue with us and stay on for your continued care. For those of you who do not live nearby and that may not be possible, your team can assist you with finding other facilities that might best meet your needs. In an outpatient setting, the frequency again is even less, believe it or not, many times that might be offered in the home, sometimes 1 to up to 2 to 3 times a week, depending. Sometimes these visits can be determined by insurance, so it's always good to kind of understand, that aspect as well as sort of the understanding that what we know of stroke recovery is that we commonly see the greatest amount of gains within the first several months following a stroke, right? And so the idea is, when we began our talk today, we mentioned that here at Gaylord, many of our stroke survivors will stay, generally speaking, around 3 to 4 weeks or so. That's about a month, right? And so we have to sort of appreciate that well after you've left us here, it's expected for you to continue to make gains, right? And so in that transitional period and working with outpatient, the idea of not necessarily having those therapies daily is not a disservice for you, but ultimately to help you with respect to extending that recovery timeframe out a little ways, right? And so your therapist in an outpatient setting will likely help you with certainly furthering your strength, certainly furthering your mobility, working with you on balance, further challenging your balance, to helping with continuing making those goals towards independence. In this setting, your outpatient therapy team may also assist you with return to work and/or return to driving functions, as we discussed in earlier videos, as well as ultimately helping you with making the transition for that next level, which is ultimately maybe a maintenance plan for you, or a program that you can kind of maintain on your own so that you continue to reap the benefits that you have in your therapy sessions when the time comes. Thanks again for watching. I'm Stephanie. Please check out our other videos on stroke and stroke recovery.